we are looking at the ventral view of an undissected human brain specimen. Here identifying the frontal or anterior pole, and we will be moving in this direction posteriorly. So first, in the frontal area, these are orbital gyri bilaterally overlying the orbit of the eye, hence the name. And then we can move medial-most to gyrus rectus, adjacent to olfactory sulcus, and identifying the olfactory bulbs and the olfactory tracts. Now we are moving progressively posteriorly toward the optic nerves, the optic chiasm, optic tracts. Between the optic chiasm and the posterior portion of the olfactory tract is an area called anterior perforated substance. Here you may be able to see these small holes where arterial branches penetrate the substance of the brain. And all of these are bilateral. You may be able to see these smaller blood vessels here. And now this territory is the only area of diencephalon that we can observe from an undissected view, and this is in fact the ventral aspect of hypothalamus. First the tuberal areas and then the mammillary areas, identified by the presence of the mammillary bodies here. We then transition into the midbrain, and that is marked by the presence of these massive fiber bundles, the cerebropeduncles, on either side. Between the two cerebropeduncles, here is intrapeduncular fossa, and similar to what we observed with the anterior perforated substance, small arteries penetrate the brain, and this is called the posterior perforated substance here in intrapeduncular fossa. We then transition to the base of the pons, the ventral aspect of the pons, and then having crossed the pontomedullary sulcus, we are entering the ventral aspect of medulla oblongata, which is flanked by the cerebellar hemispheres. The ventral view of the brain with the brainstem and cerebellum removed will give us access to the occipitotemporal areas, starting with the temporal pole, the inferior temporal gyrus, moving medially and posteriorly, the occipitotemporal gyri. The occipitotemporal gyri, as the name suggests, are in part in the temporal and in part in the occipital lobe. We then move more medially, identifying collateral sulcus, which separates the occipitotemporal gyrus from the more medial parahippocampal gyrus. Note the anterior-most inward turned area of parahippocampal gyrus, the uncus. We then move posteriorly into the occipital area to identify the occipital gyri using a general collective term. Once again, occipital gyri close to the occipital pole. I would like to point out a few more structures and regions of interest in this specimen with the brainstem and cerebellum removed. Once again, coming from the ventral perspective. These are the cut profiles of cerebropeduncles forming the base or the ventral aspect of midbrain. The space between the two cerebropeduncles here is identified as the interpeduncular fossa. Note that the oculomotor nerve roots are emerging from the interpeduncular fossa. The interpeduncular fossa is also the site of the posterior perforated substance, visible here. Here's the ventral view of the brain again, but with a close-up view showing us hypothalamic areas here. This is a specimen with an unusually good preservation of pituitary stalk. Here is pituitary stalk, which emerges from the central area, the tuberal area of ventral hypothalamus. We can move anteriorly from here towards the optic chiasm, and the optic chiasm underlies the preoptic and anterior hypothalamic areas, back to tuberal, pituitary stalk again, and more caudally we can go to the mammillary level here with the mammillary bodies. And this was just a close-up of ventral areas of hypothalamus.